When a cold climbs up into your head, it creates a kind of misery that is hard to explain to anyone who is not feeling it right then. Your nose closes over until breathing feels like work. Your face feels packed and pressurized. Your ears can feel dull, your sleep turns shallow, and your thoughts move as though they have to push through wool to get anywhere. You keep swallowing, blowing your nose, rubbing the bridge of it, trying one more deep breath, hoping something will finally open, and instead everything stays thick, blocked, and stubborn. It is not the sort of illness that always frightens people, but it is exactly the sort that can wear them down, because it keeps on hour after hour and makes the smallest task feel heavier than it should. That is why simple relief matters more than people admit. When you are in the middle of congestion, you are not asking for a miracle, you are asking for enough ease to think clearly, enough comfort to sleep, enough movement in your head and chest that you can stop feeling trapped inside your own breathing. And for that ordinary kind of suffering, the plainest things are often still the things that help most, not because they are fashionable, not because they are hidden secrets, only because the human body has not changed so much that warmth, moisture, rest, and patience have stopped being useful. Before I go any further, let me say this as carefully as I can. I am not Dr. John, and nothing in this talk replaces medical care. This is for the ordinary congestion of an ordinary cold, the kind that makes you feel miserable for several days and then, in most cases, gradually lets go. If Dr. John is already caring for you, if you have a lung condition, if you are taking medicines that affect your breathing, or if you are dealing with something more serious than a simple cold, speak with Dr. John before trying anything new. What I am offering here is not a cure. It is not a promise to make a cold vanish. It is a practical way to soften the discomfort while your body does the slow work of getting through it. And the first thing worth understanding is something most people never hear said plainly enough. The mucus itself is not the villain people imagine it to be. It feels like the villain because it is the part you notice. It is the thick pressure, it is the drip, it is the clog, it is the thing keeping you from breathing comfortably. But in many cases it is your body doing what it was built to do. When your nose, sinuses, or throat are irritated by a virus, your body increases mucus production to trap that irritation and move it out. The problem is not simply that mucus exists. The problem is when it becomes so thick, sticky, and stubborn that it stops moving the way it should. Then it sits there like wet plaster, and the whole head begins to feel sealed shut. That is why the real goal is not to shut everything down. The goal is not to punish your body for trying to clear itself. The real goal is to help things loosen, thin, drain, and move. Once you understand that, a lot of exaggerated advice starts to lose its shine. You stop hunting for the dramatic promise that claims to blast congestion away instantly, and you start paying attention to the quieter things that help the body do its job with less misery. If you remember only one part of this whole talk, let it be this. Warm moisture can make a bigger difference than people expect. That can mean a hot shower, a steamy bathroom, a humid room, or careful steam breathed from a safe distance. It does not sound exciting enough for the internet, and maybe that is exactly why people overlook it. But thick congestion tends to cling and harden when everything is dry. Warm moisture helps soften what feels packed in place. It helps turn something stubborn into something movable. And when that congestion begins to loosen, even a little, the pressure can ease enough for you to feel like yourself again. Now, I want to be very careful with how I say that, because useful advice becomes bad advice the moment people turn it into excess. Warm steam can be soothing. Burns are not soothing. If you use steam, use it safely. Keep your face well away from boiling water. Do not lean so close that the heat becomes harsh or painful. Do not leave children near hot water. If a bowl of hot water feels awkward or risky, then do not use one. A long hot shower in a closed bathroom may be the safer choice for you. You do not win anything by making the method more extreme than it needs to be. Gentle relief is the point. The more reason this matters so much is that congestion often makes people tense without noticing it. When your nose is blocked, your whole body starts working around it. You breathe through your mouth, your throat dries, your shoulders lift, your sleep fragments. You begin to feel not only stuffed up, but irritated, tired, and strangely boxed in. Warm moisture can interrupt that spiral. It does not solve every part of the cold, but it can take the edge off the feeling that your entire face has become one solid wall. Then there is the next thing people underestimate until they need it themselves, a warm drink. There is something almost embarrassingly simple about saying that a cup of something warm can help when you are congested. People are used to dramatic claims now. They are used to hearing about miracle ingredients, rare herbs, instant cleanses, and secret formulas. So when someone says take a warm cup, sit down, sip slowly, and let your body settle, it can sound too ordinary to matter. But the ordinary things are often doing more than people think. A warm drink helps in several ways at once. The heat can feel soothing on a sore throat. The vapor rising from the cup gives you another small dose of warm moisture while you breathe. The act of drinking encourages you to take in fluid, which matters when thick secretions are making everything feel stuck. And maybe just as important, a warm cup slows the whole mood of suffering down. It tells the body, and the mind with it, that for a few minutes you are not fighting, straining and pushing, you are resting, you are allowing comfort. That is not weakness, that is intelligent care. If you want to keep it simple, simple is enough. Warm water with honey, if honey is appropriate for your age and situation. A little ginger if you like the warming feel of it. Lemon if that tastes good to you. Mint if you find it refreshing. You do not need a potion. You do not need 10 ingredients that nobody can pronounce. A warm drink is not valuable because it sounds impressive. It is valuable because it can soothe, hydrate, and comfort you at the exact moment when comfort is hardest to come by. And notice the honesty built into that. A warm drink is not a cure for the cold. It is not a substitute for medical treatment. It is not some underground trick that outsmarts illness. It is support. It is kindness. It is relief you can feel without pretending it is more than that. And strangely enough, when advice is that honest, it often becomes more powerful, not less. People trust what does not try too hard to sell itself. If the worst part of your congestion is in the nose itself, then one of the most useful tools can be saline. A saline spray or a gentle rinse can help thin out what is sitting there and help wash away some of the irritation that keeps the nose swollen and blocked. For many people, this is one of the clearest examples of a simple remedy actually earning its reputation. It does not need hype to feel helpful. When it works, you know it because breathing feels less crowded. But here again, the plain remedy still has rules. Gentle matters, safe water matters, proper preparation matters. If you are using a rinse rather than a basic spray, use distilled water, sterile water, or water that has been boiled and cooled correctly. Do not take shortcuts with that part. Ask Dr. John if you are unsure what method is safest for you. The inside of the nose and sinuses is not a place to get careless because someone online made it sound casual. There are also people for whom saline care is not the right move in every situation. If you have had recent sinus or ear surgery, if you have severe blockage, if you are unsure whether a rinse is appropriate, or if you tend to have problems with it, speak with Dr. John first. Good home care stays within the boundaries of common sense. The whole point is to help, not to turn a simple remedy into a needless mistake. And then we come to two things that almost every person nods at and almost every person neglects: rest and fluids. They sound so obvious that people discount them, which is unfortunate because the most obvious supports are often the ones that change the entire experience of a cold. When your body is congested, run down, inflamed, and tired, it is already using energy. If you insist on pushing yourself as though recovery were a character flaw, you often end up extending the exact misery you are trying to outrun. Real rest is not the same as collapsing while staring at a screen and calling it a night. Real rest means reducing demands where you can. It means lying down earlier. It means not treating every hour of the day as a test of toughness. It means allowing your body some quiet room to work. Many people are willing to buy expensive products before they are willing to grant themselves permission to rest, and that is one of the stranger habits of modern life. Fluids matter for a similar reason. When you are dried out, congestion tends to feel thicker, harsher, and harder to move. When you keep up with water and other appropriate fluids, you give the body a better chance to keep secretions from turning into glue. That does not mean drinking absurd amounts in the hope of flushing the cold away. It means being steadily sensible. Sip through the day. Do not wait until your mouth feels like paper and your throat feels scratched raw. Consistency helps more than intensity. I think part of why these plain remedies continue to resonate is that they belong to a kind of care people recognize even if they cannot always name it. It is the kind of care that does not perform. It does not make a speech. It does not come with a dramatic promise. Someone hears it in your voice that you are clogged up and tired, and they start making the room easier to be sick in. They bring water, they suggest a shower, they put a warm cup into your hands, they lower the noise, they tell you to stop doing so much. They do not announce a breakthrough. They simply reduce the burden. That kind of care feels old because it is old. Long before every discomfort was packaged into a product, people still had to help one another through ordinary illness. They knew from experience that a person with a heavy cold often needed less stimulation, more warmth, more time, more moisture, more stillness. They did not have to pretend those things were magical in order for them to be worthwhile. And maybe that is one reason people are so drawn to videos like this now. A lot of the world is loud, fast, monetized, and exaggerated. Congestion is uncomfortable enough on its own. What people really crave, sometimes without realizing it, is someone who will speak to them calmly and truthfully. Someone who will say, "This is miserable, yes, but not everything miserable requires drama. Some things require patience, decent care, and the wisdom not to expect a miracle from every uncomfortable hour." Still, there is a line that responsible people should draw clearly, and I want to draw it clearly here. Ordinary congestion is one thing. Warning signs are another. If you are having trouble breathing, if your breathing is fast or labored, if you have chest pain, if you develop a high fever that persists, if you are coughing up blood, if you are becoming unusually weak, confused, or dehydrated, or if your symptoms are not improving and instead keep dragging on or worsen after seeming to improve, that is the point to stop treating this as ordinary home care territory and contact Dr. John or seek urgent medical attention. This matters especially for children, older adults, people with asthma or other lung conditions, people whose immune systems are weaker, and anyone whose health is already fragile. In those situations, it is better to be cautious sooner. A gentle home measure can be a perfectly reasonable comfort for an uncomplicated cold. It is not a replacement for judgment, and it is certainly not a replacement for Dr. John when signs point to something more serious. I say that because one of the dangers of overhyped health content is not only that it exaggerates benefits, it also blurs boundaries. It teaches people to feel as though every symptom should yield to the right hack, the right drink, the right ingredient, the right trick. But the human body is not a lock waiting for the correct key from a video thumbnail. Sometimes relief is simple. Sometimes the correct next step is medical care. Wisdom is knowing the difference. And that brings us to the part of this whole subject that gets the most attention online, the miracle claim, the one cup, the one spice, the one method. The thing that supposedly clears your lungs instantly, melts away mucus in minutes, drains the sinuses overnight, or does what doctors never mention. Those claims spread for obvious reasons. People are uncomfortable, they are tired, they are impatient. They want hope, and strong promises feel like hope when you are miserable enough. But a big promise is not the same thing as a good promise. In fact, the bolder a claim sounds, the more carefully it usually deserves to be questioned. Because what is being sold in most of those moments is not only a remedy, it is a fantasy of control. It is the idea that with one perfect trick you can skip the slower reality of illness. That fantasy is emotionally powerful, which is why it performs so well. Yet emotionally powerful is not the same as trustworthy. The truth is quieter. Steam may help loosen congestion. Saline may help rinse and thin what is stuck. Warm drinks may soothe and hydrate. Rest may help you recover with less misery. Water may help keep things from getting thicker. None of that is flashy. None of it sounds like a secret worth shouting in all caps. And yet those plain supports endure because many people find them useful when they are used with realistic expectations. What often gets lost is that realistic expectations are not disappointing, they are freeing. Once you stop demanding that every remedy prove itself by acting like a cure, you can appreciate the actual value it offers. A warm shower that helps you breathe through the night for the first time in 2 days has done something meaningful. A saline spray that lets you think clearly enough to answer a message without irritation has done something meaningful. A mug of something warm that calms your throat and settles your body before sleep has done something meaningful. Relief does not become worthless just because it is not dramatic. There is also a psychological comfort in returning to remedies that are ordinary and grounded. They remind you that the body often needs support more than spectacle. They remind you that feeling cared for is part of healing through discomfort, even when the care is as simple as warm air, warm fluid, and permission to stop striving for a few hours. They remind you that not every problem in the body requires a product with a story. Some require an environment that makes suffering easier to carry. Think about how many people have been taught to distrust anything that costs little and promises modestly. If a remedy is cheap, accessible, familiar, and honest about its limits, a routine can matter more than something that merely sounds intense. That is one reason the emotional effect of plain-spoken advice can be so strong. It does not just tell people what to do, it lets them stop performing illness as a battle that has to be won theatrically. It gives them permission to care for themselves without embarrassment. It says you do not need to turn this into a production. You need to breathe easier, rest better, and keep enough perspective to know when to call Dr. John. So if you feel a cold settling into your head next time, and the pressure begins to build, and you start looking around for the fastest, strongest, most dramatic answer, pause for a moment before you chase the promise that sounds the loudest. Ask instead what would genuinely make your body's work easier. Would warm moisture help loosen things? Would a hot shower soften the pressure? Would a saline spray or rinse be useful if used safely? Would a warm drink settle your throat and encourage fluid? Would more rest today save you from more misery tomorrow? Those are not glamorous questions, but they are often the right ones. And there is another kind of relief that comes with this approach. It spares you the disappointment of expecting too much from too little. If you go into every home remedy expecting it to crush a cold overnight, you are likely to end up frustrated, suspicious, and still congested. If you go into it understanding that its purpose is to ease, support, and soften, then you can judge it fairly. You can feel what it actually gives you. And very often what it gives is enough to matter, enough to sleep another hour, enough to breathe through one side of the nose, enough to loosen the pressure behind the eyes, enough to stop feeling so trapped in your own head, enough to get through the day without hating every minute of it. That may sound small when you are healthy. It does not sound small when you are the person who has been awake at 3 in the morning wondering how something as ordinary as a cold can make the whole world feel so narrow. In that moment, ease is not a luxury, it is a mercy. And perhaps that is the most useful way to think about these old simple measures, not as weapons, not as miracle hacks, not as secret cures, as mercies, as practical kindnesses, as ways of reducing suffering while the body works at its own pace. There is no shame in valuing that kind of help. In fact, there is something mature about it. It means you have stopped confusing exaggeration with effectiveness. If Dr. John has given you guidance that fits your own health history, follow that guidance first. If something about your symptoms worries you, trust that concern enough to reach out. And if what you have is the usual heavy-headed, stuffed-up cold that comes on, lingers, and gradually fades, then give yourself permission to do the simple things thoroughly instead of doing the dramatic things hopefully. Let the bathroom fill with steam while you stand there breathing more freely. Sip something warm instead of scrolling for one more miracle cure. Use safe saline care if it suits you. Keep water nearby. Lie down earlier. Reduce the noise around you. Let the body spend its energy on recovery rather than on keeping up appearances. These are not weak measures, they are steady ones. And steady often beats dramatic in real life. There is another reason simple routines work so well when you are congested. They reduce the feeling of helplessness without pretending to give you total control. Illness can make a person feel passive, trapped, and impatient all at once. You do not want to sit there waiting. You want to do something, but not every something is useful. What these steady measures offer is useful action without false promises. You can create warm moisture, you can choose rest, you can drink water, you can prepare a safe saline rinse, you can make the room calmer. You can stop aggravating your own discomfort by chasing stimulation when what you need is recovery. That matters psychologically as much as physically, because a person suffers less when they feel they have a sane way to respond, not an extreme way, not a theatrical way, a sane way. And sometimes that emotional steadiness is exactly what keeps a simple cold from feeling bigger than it is. It reminds you that discomfort is real, but panic is optional. It reminds you that patience is not the same as doing nothing. It reminds you that care can be active, deliberate, and effective even when it is quiet. People do not always remember the fanciest remedy they tried when they were sick. They remember the one that finally let them rest. They remember the first deep breath that did not feel blocked. They remember the night they slept. They remember the feeling that the pressure had finally started to break. Relief becomes memorable when it changes your experience, not when it sounds impressive in a headline. So the next time a cold settles into your head and turns your face into a closed room, remember this: you may not need a spectacle, you may not need a promise wrapped in hype. You may need warmth, moisture, fluids, patience, and enough wisdom to know the difference between ordinary suffering and a reason to call Dr. John. That is not glamorous advice. It is better than glamorous advice. It is useful. Take good care of yourself. Take good care of the people around you. And if you find that one of these plain supports helps you more than the louder remedies ever did, pay attention to that lesson. The body often responds to calm, consistent care more honestly than the internet does. When the head feels packed, help it loosen. When the throat feels raw, soothe it. When the body feels tired, let it rest. When the symptoms cross the line into something more serious, call Dr. John. That is a steadier way through a cold than chasing every bold promise that passes in front of you. And in a time when everything is trying to sound extraordinary, there is still great power in what is simply true. That is why small rituals matter during a cold. Repeating them gives shape to an unpleasant day. Shower.